But what people have been discovering the last few years, especially around the serotonin system in mammals generally, is that one of the core functions of serotonin signaling is to gate sensory information. It sort of tunes how much what you might call raw sensory information goes deeper into the brain and gets further processed. And so it fits quite well, I think, with what you're telling me.
Mm, yeah. No, sure. But let me push this a bit further. Okay. Yeah. I got involved in looking at the serotonin system way back. And if you ask me what I was doing, why I did all this, I'd actually, first of all, done medicine. But thought before I go into the mental health field, it would be a good idea to do some research. And yeah, the serotonin system was just vaguely coming on the map at that time. And, uh, having an interest in therapy, actually talking to people, it was a little bit odd to be in a pharmacology lab looking at things like the serotonin system. And if you asked me why I was doing it, I would have said, well, I'm interested in the philosophical problem about how the mind fits into the brain.
Mm-hmm.
Okay. Now, in particular, I was interested in how the female mind works, basically. But hey, I've realized that it's the issue we've got is not how does the mind fit into the brain. The brain is almost irrelevant. It's how does the mind fit into the body?
Mm.
Because uh, and the serotonin system brings the point out quite well, which is only roughly 5% of the serotonin in you and me is in what we call our brain, and it's in the reptilian bit of the brain, the ancient bit of the brain. If you look at what we think of as the human brain, the cortex and things like that, there's some nerve endings there, but there's no serotonin based there. 95% of the serotonin in you and me is in our bodies. And it's linked principally to the sensory system. And as you say, what it does is it gates things. And you can open the gate with LSD and flood the brain with all sorts of things. If you chat to people who are into LSD and things like that, they talk about the mind a lot and the brain a lot. They don't ever think that LSD may be acting on the rest of the body.
Mm-hmm. Yes.
The visual effects, they think, well, these are all in the brain. There's a lot of serotonin in our eyes, which is not part of our brain.
Yeah. Yeah. Yeah.
Nobody stops to think about maybe the effects of LSD are as much in the eyes as anywhere else. With SSRIs, they have huge visual effects. And talking to ophthalmologists, they assume this is all to do with the brain because we've been marketed to, we've been told the serotonin in your brain is low when your mood is wrong, and these drugs top that up. There's no serotonin that's abnormal in the brain when we get clinically depressed. Once we take these drugs, your serotonin is going to be a lot more abnormal than it was beforehand.
Mm. Yeah.
But the effects of these drugs, when you listen to people and things like that, they've got visual problems, they've got genital problems, they have sexual dysfunction that may last
Yeah.
for the rest of their life after they halt the
Yeah.
drug.
So,
You
so
know,
the acute effects, literally the first pill that you feel results in many people in this genital numbing effect, this dampening of sensation. What are the specific visual issues that people report?
yeah, well, one of the things that's on the radar these days is a thing called visual snow
Hmm.
syndrome. And that's comprised of a bunch of different things. First of all, people have flecks of white. They've got what we used to actually describe with old style
Hmm.
TV
Like
sets
static
was
in their visual field.
you've got static. Yeah. The other thing that goes with it is that you've got night blindness that you can't really make things out. If your job involves having to drive a car at night, you're in trouble.
Hmm. So
You've also
SSRIs
got
are basically elevating.
alanopsia. Have you heard of this one?
No.
Yeah, that's after images. You
Hmm.
know, um, you've got, you see the thing you're looking at, and then you close your eyes and you see
Hmm.
after images. going on for ages. You've got a bunch of different things that are actually happening to your the visual system, but they're the things that are most clear cut.
And those things show up right away in the first day.
No, 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 they don't. They may show up only after a period of time, but they also may endure after you've halted the
Hmm.
pills for the rest of your life, just like your sexual problems.
Hmm. What percentage, roughly speaking, can you give us a sense for, okay, if the most acute effects, the ones that show up immediately, the dampening of sensation in the genitals, is that rare? Is that common? Can you give us a sense for how common that is?
That happens close to 100% of people.
Really?
Yeah, and this brings out
So
the
whether or not they're going
problems
to
of
end
what
up
we've been.
having the antidepressant endpoint, that's something that you tend to see in almost everyone right away.
Yes, and you're told by FDA, well, the thing that's most common is that these drugs help you. The problems are quite rare compared with that. So there's a benefit risk ratio that's favorable to taking the pills. That's all wrong. You
Wow.
know, you may be helped by the pill. You absolutely will be genitally affected by the pill. And you aren't being told about this. Um, it isn't just that. I mean, you get numb kind of genitals, your orgasms mute, and over a period of time, you lose libido. But also over a period of time, if you're male, your sperm count goes to the floor.